The Office for National Statistics says that in Wales, the percentage of people testing positive for COVID is no longer falling. The First Minister, Mark Drakeford, says Wales is experiencing an unmistakable rise in coronavirus once again. And he said more people are being admitted to hospital with symptoms, putting the health service under sustained pressure. The ONS says there are early signs of decreasing levels of infection in Scotland, and in Northern Ireland the existing decline is continuing. In England, the number has fallen slightly to between 0.8 and 1. Infection levels are down in all age groups. Greater Manchester councils have joined Sheffield in pausing rapid testing for care home visitors over concerns they don't detect enough infections. The data suggests these rapid kits miss about a third of the most infectious cases picked up by conventional lab tests. As for the vaccine, we reported last night on the programme that NHS staff will not be at the front of the queue after all, and it's now clear the UK will not get the expected 10 million doses delivered by the end of the month. With the latest vaccine headlines, LBC's Phil McDonald.
Well, Eddie, as we head towards Christmas and that 5-day easing of restrictions across the four nations, most of the numbers, high as they are, appear to be heading in the right direction. The evidence suggests that the spread of coronavirus in the UK is receding. As you said, in England, the R number has fallen slightly to between 0.8 and 1. That's down slightly on last week when it was not 0.9 and 1 between those numbers. So these new figures that we've got from the ONS suggest that the infection levels in the UK are the lowest they've been since the end of September and are down in all age groups. The data shows the proportion of people testing positive for the virus is estimated to have fallen in all regions of England except the northeast, where rates appear to have levelled off. Last week, the number of positive cases fell in England and also in Scotland and Northern Ireland, but there is a slight concern about Wales, which I'll talk a little bit more about, beg your pardon, in a moment. But we've had another update on the delivery of Pfizer's COVID vaccine, which is going to be rolled out from next week. It's now clear that the UK will not get the expected 10 million doses delivered by the end of the month. The Business Secretary, Alok Sharma, spoke to LBC's Nick Ferrari at breakfast.
Hopefully we will get more doses by the end of the year, but we've always said that the bulk of the vaccination program will take place next year. And of course, you know that AstraZeneca is also being reviewed by the MHRA. I mean, we don't know the timing of when they will pronounce on it, but again, that's a vaccine where we have secured 100 million doses.
So there's a fair amount of uncertainty now about the upcoming immunisation programme. We know that people administering the vaccines, care home workers and those over the age of 80 will be among the first to receive doses from Tuesday. At today's daily briefing in Edinburgh, Scotland's National Clinical Director, Jason Leach, was asked when we might see the whole adult population given the jab, but he wouldn't go into specifics.
It seems to me that if we give you a season, you ask for a month. If we give you a month, you ask for a specific week. There are just too many unknowns. We don't know which vaccines will be authorised. We don't know how many of each vaccine we'll get. We know how many we've bought, so 100 million doses across the UK of the AstraZeneca vaccine. So the AstraZeneca vaccine is very important to us. If that gets approved soon rather than later, that helps us. It brings everything forward a little bit. What we've said in the whole UK is that we're hoping to get to that over 50s group by the summer, and that would allow us to remove 99% of the mortality of this disease.
And we know that the first vaccines have been delivered in Northern Ireland. They've just arrived from England, are being kept in a secret location. We know that as well there are going to be big changes in Wales, which come into effect in just under an hour's time. A new curfew for pubs, cafes and restaurants is coming into force, meaning they'll have to close at 6 p.m. They also can't sell alcohol at all. The reason for these measures is that the situation in Wales is causing the government there some concern as COVID-19 case rates are rising in almost every part of the country. The biggest jumps are in Neath, Port Talbot, Swansea and Merthyr Tydfil. The Welsh government says that these new rules will be in place until the situation changes. At today's briefing, First Minister Mark Drakeford said tough rules are needed.
Every day we are seeing more and more people admitted to hospital with coronavirus symptoms. In the last week, we have seen a record number of coronavirus-related patients in our hospitals, and these numbers are increasing.
But despite these new rules, there's going to be a relaxation of travel restrictions, which will allow people in Wales to travel to areas of England under Tier 1 and
Barrett, sorry to keep you waiting, but we're coming to you right now.
Okay, thank you.
grab Christmas shopping deals or grab a drink in areas where pubs and restaurants can sell alcohol. So all in all, it does appear that the UK is in a far stronger position in the fight against the virus, with the R number and infection rates down. But as we've just been hearing, there is still a long way to go with many challenges ahead, Eddie.
Phil McDonald reporting, and we'll be live in Cardiff before 6 o'clock. Dr. Bharat Pankania is back on the programme, I'm happy to say, Senior Clinical Lecturer in Public Health Medicine at Exeter Medical School. How are you?
Very well. Thank you, Eddie. Thank you. How are you?
I'm very well, and there's so much to talk to you about. First of all, the news that councils in Greater Manchester have followed councils in Sheffield in pausing rapid testing for care home visitors because it seems these tests fail to detect enough infections.
Yes, and I think it is a good move, a good, brave, honest move. And for some time, people like myself and my colleagues have been saying, look, you're doing these tests. What is the sensitivity of them? What is the specificity of them? And we do know that in expert hands, you have high sensitivity. Then self-administered, you have much lower sensitivity. And therefore, when you are testing in residential homes, nursing homes, unsupervised, you will be missing quite a lot of otherwise infected, infectious cases, and falsely reassuring yourself that all is well just because you happen to get a negative result.
Now, obviously, the primary concern is about people's health, but these tests are playing an important role in reassuring people that it's possible to get close to their loved ones again.
Yes, but we need to get these tests right. We either have personal protective equipment properly worn and you properly test, or you don't falsely reassure yourself by taking a symbolic test. It gives you a negative result, and then you get close to your loved ones and infect them, and unfortunately they get severe illness. We don't want to do that.
As we heard from Phil, some encouraging statistics in England, in Scotland and Northern Ireland, but Wales causing concern. How do you view all those statistics today?
And, it's very sad to see Wales had its firebreak restrictions, and then it lifted them, and then it looks like today they're back to square one. And the bottom line is this: wherever you have human interactions, you have case numbers that go up. And also the COVID-19 is a clear indicator of poverty. And again, this is something we don't like to talk a lot about, but poverty and the disease, the infection go hand in hand. So where you have houses of multiple occupation, density, people going out to work because they need to bring bread to the table. Those are all ingredients for getting infected and having higher case numbers.
What do you make of the news that NHS frontline staff will not necessarily be near the front of the queue for the vaccine?
I think the real answer is a shortage of a vaccine. At the moment, AstraZeneca have not been licensed. That's the easier one to administer and give in large numbers. And then we've got a call on the Pfizer BioNTech vaccine, but not in large enough numbers and difficult to administer. So the decisions are being made about what do we do with these small numbers that we've got available.
Are you concerned that the excitement and optimism about the vaccine might lead some people to abandon their cautious behaviour in the coming weeks?
It is very important, and I'm really concerned about the Christmas relaxation of restrictions, because on the 2nd of December, we came out of lockdown and there is more increased activity. And then leading up to the 24th, 25th, 26th, 27th of Christmas, December, there will be much more interactions. So I'm really concerned about January giving us a further spike in number of cases, and this is before the vaccines have been deployed.
Do you think the relaxation as it's currently being described and the rules contained therein, do you think that's an error?
Well, it's very difficult to police, and my observations are that whilst we've got all these large swathes of the United Kingdom in tier 2, 3, difficult to police, and there's The evidence is, why are your case numbers still persistently high? And they are high because despite the restrictions, there is ongoing interactions with other human beings. And then we also mustn't ignore schools, colleges, universities also generate cases, which then lead to older age people getting infected, and then even older people, and then the more older people get severe illness, and then the ITUs start filling up.
As you know, and we had calls about this all this week from listeners, there is concern, not from people who are necessarily anti-vaccination, but who just look at the speed with which this first vaccine has been approved and wonder, well, how can it have happened so quickly? And then you have Dr. Fauci making remarks in America, which he's somewhat retracted, again, just raising a question mark over how much we can trust this approval. What do you say?
Yes, and whilst I have faith in our own regulatory authorities, the MHRA, my answer was, look, I don't know if pressure was put upon MHRA to approve it faster because there was political point scoring to be made and to be had. I really don't know. I don't doubt the MHRA. I just wonder if they were told to hurry up. The answers I have got are that the MHRA was preparing in the background to get this data, to approve it as soon as they got it, and that's why they were able to approve it as soon as possible. I have to take them at their word.
Thank you for talking to us as always. Stay well. Dr. Bharat Pankania, Senior Clinical Lecturer in...
Thank you very much, Dr. Pankania. That was great as always.
517 Top
Have a lovely weekend, sir.
News.
Talk.
Bye-bye.